Hi everyone, welcome back to the Dr. Sia channel. It's 2021 and I have a lot of things to talk about, so I hope that you've been enjoying the channel as much as you've been able to in 2020 and that you will continue to enjoy all the videos that I make here in 2021. Now, this video series that you're part of here today is called, I actually don't know what I should call it yet. I should probably think about that now. Anyway, the topic that we're going to be talking about is common ISTDP practitioner mistakes. So this video and this series that I'm making, it's going to be about 10 videos, is actually really geared towards high-level psychotherapists, people who have done their run-of-the-mill training and they're either part of doing ISTDP training at the moment or are already done with their training. Now, the whole thing around ISTDP is that it's a phenomenally effective psychotherapy, as anyone watching this has experienced either through being a patient or being a practitioner or both in many cases. But it's a very difficult therapy to do because so often you're working on this idea of the unconscious. So you're working on body language, you're working on mimics, on tone of voice, on what is not said. And trying to do that at the same time is trying to keep an eye on what is said and what has happened. And so all the conscious processes and all the verbal processes at the same time as all the nonverbal processes is a very difficult thing to do in psychotherapy in general. And then to do that with a therapy that tries to keep in mind, if you will, the entirety of a person, in my opinion, ISTDP is the most holistic therapy there is. And so it's kind of a therapy that's trying to take into consideration everything about the person, their values, their ideas, their beliefs, their thoughts, their feelings, kind of their tendencies for behaviors. So it's just such a holistic kind of therapy, and trying to take everything into consideration at the same time as you're managing yourself, your own feelings, your own anxieties, your own countertransference, managing your patient's countertransference, and sort of managing time and everything else that you know goes on is a really big challenge as a therapist. So this video here is just an introduction of the series that that I'll be uploading, and it's going to be 10 videos or so. And we're going to be looking at, and I'm just going to talk about the topics now that are upcoming so that you know. It's going to be overlooking projection, assuming an internal problem. So these are problems, these are common mistakes that ISTDP practitioners make, in my opinion, sort of like what I've seen my students do or what I've done myself or kind of what I've seen my colleagues do. No, they're not ranked by any case, but it's just 10 of them. Overlooking projection, assuming an internal problem, assuming task agreement, overemphasis on feelings, overemphasis on costs of defenses, assuming anxiety over fear, not checking for agreement, speeding past building structure, not addressing conscious resistance, and overlooking synchronicity. So that's basically what this series is going to be about. And I hope you enjoy it. And if you do, if you can't wait for the next one or for the first video in this series, just, skip to next. I believe it should come up to overlooking projections, which I will record after this right now. And I'll try to upload this video at the same time as I upload the overlooking projections so that you kind of have something to move on to. Otherwise, it would be pretty sucky. Anyway, I'm in a very good mood. I hope you are too. A new year, new start, new beginning, lots to learn. Let's get started.